Uh, Thank you, Dr. Devashish, uh, and thank you, AIOS, as well as uh, the Optos group for giving me this opportunity to be here today in a very sort of a light group talking about a modality which, in fact, has really revolutionized, I think, the retinal imaging. And I'm going to talk to you a little bit about ultra-field, wide field imaging in uveitis, although I'll be just showing you some of the cases. And basically, I think all these things have been talked. I'm not talking about these things. They have been very nicely dealt with. And so is about what we have, this non-contact and the fields. Everything has been very nicely dealt. And so I think here I'm just talking something which has been published from our group. This is the ultra-wide field in paradoxically worsening in TB uveitis. You see, in this study, what we had found that we could see additional lesions, significant additional lesion than on conventional imaging in paradoxical worsening, which happens after multifocal serpiginous choroiditis once you put them on antitubercular treatment. That's how these days, in fact, it is from our group, the whole work has come, especially it was Professor Amod Gupta's guidance and subsequently Dr. Vishali Gupta. And they have now devised a way that these patients need to be put on immunosuppression before the ATT is started. That's otherwise they can worsen very fast. And so the management also was altered. You see, almost in 38% of the cases in these. Only thing is, I can't show you the images here somehow because since I am retired now, somehow I had images somewhere, but I could not get them as far as this paradoxical worsening is concerned. But I'll be showing you other images which were with me, especially for the retinal vasculitis. I think ultra-field imaging and especially the fundus fluorescein angiography in vasculitis, which is going to tell us both about the vasculitis part, which will show a peripheral leakage and CNP areas, as well as new vascularization and so many other things which are seen. So I'll be sharing some details regarding some cases regarding this. This is one picture. You see, you can see, I don't think you can get a picture like this otherwise if you don't have Optos machine. Now, what you see here is, I'll show you subsequently the cases here of a disease which is more and more we are diagnosing. This is Irwan. And these cases are very frequent. And you can see neovascularization of the disc here and extensive these peripheral non-perfusion all around 360 degree. As well as, of course, there are other features of vasculitis. You can see those little leakage around the vessels. So all these features can be very nicely picked up with the fundus fluorescein angiography, which has been performed with the Optos. So we had published, in fact, we have published almost like 4 papers on this particular entity from our center. And I'll show you some of the cases out of that. The one case which I'm sharing here is a 34-year-old male. And you can see here what is happening is that you are seeing these vessels here, and these vessels are occluded, some laser scars over here, you can see, as well as you can see these are all sclerosed vessels. And this featureless retina, totally as if it is not having anything. So we expect it to be ischemic. And the best part is, look at this angiogram, ultra-wide field angiogram. And that is what you see here. This part is not perfusing. So are the other area. You can see some laser is performed here. But what you see here is much more clearer in the next frame. And you can see now the new vascularization of the disc and extensive area of capillary non-perfusion. And all around here also you can see how much area is there which is non-perfused. And you see these knotted kind of, you see vessels, which were seen better here. You can see these knots are very typical. They are along the arterioles. This is the hallmark of diagnosis of IRWAN. So these knots, arterial knots, which are seen along the arterioles, they'll be seen. So that is what happens in them. And so subsequently, you can see almost the diffuse kind of a leakage happening here. And this particular case was finally lasered. And you can see here how much laser was required. And you can document everything, as well as you can monitor. I'm not going into the whole follow-up of this case, but you can monitor, and you can even retreat if there are certain areas which require treatment. So that is what is the importance of doing this kind of imaging as well angiography in these cases. I'll share another case of IRWAN with you. 14-year-old girl. She came with just hand movements vision in both eyes, and conventional imaging shows something like this here in both the eyes. You can see extensive problems. But what was that we diagnosed this as, again, IRWAN. So she received intravitreal bevacizumab followed by partial vitrectomy and endolaser photocoagulation in both eyes. And that is the way these are, just with your normal conventional camera. But I just wanted to share with you here. Just look at this picture. Now, this is the right eye. Now, you can see after partial vitrectomy, extensive laser has been done, and you can demonstrate that. You can demonstrate the exudation here, as well as you can demonstrate these closed vessels. But what is very important here is, look at this angiogram. Can you imagine seeing anything like this? You can absolutely image everything, and the extensive area still seen here, where you may put some more laser. Even what was surprising is how this girl is seeing 20/30, 6/9, and there is some macular ischemia here. Despite this, she's seeing that kind of vision. So I think this kind of a documentation is not possible without this kind of ultra-wide field imaging. And this is the other eye, same way, where pars plana vitrectomy was done. You can see extensive laser done, sclerosed vessels, and look at the angiogram. And here the vision was poor, just about 6/60, 20/200 here. And somehow, I don't know what was the reason that eye was seeing better, but you can see here how the whole retina was knocked off and has been lasered. And that's how you could control such a aggressive disease. Despite that, you can still see here some neovascularization of the disc. So I think in vasculitis of any kind, I have not shown you the conventional vasculitis. There are so many, as well as a nice example shown by Dr. Chang of Eel disease, which in fact, these days hardly we diagnose. Mostly there is a cause for that. Maybe these cases are tubercular or other sarcoid. That is what happens in them. And I would like to again show you a very interesting case. 66 years old male presented with count finger vision in both eyes. The anterior segment was normal, and the clinical diagnosis only was suggestive of a bilateral vitreoretinal lymphoma with multiple branch retinal inclusion in the right eye. So this patient, because we wanted to confirm the diagnosis, underwent partial vitrectomy with subretinal biopsy, which did confirm B-cell lymphoma, and was treated subsequently with the intravitreal methotrexate 0.4 milligram in 0.1 ml. I'll be showing you all that. This is the way the patient presented. You can see here what is happening here is you have upper temporal and nasal occluded vessels. That is what the multiple branch vein occlusions are there. And you can see other features here, multiple yellowish exudates inferiorly. And look at the other eye. So this is what, in fact, was so suggestive of the diagnosis that we were almost sure that we are here dealing with. So you had these kind of yellowish elevated subretinal lesions, and on observation they can be seen that they can change in shape. They can sort of so that is what you see clicks the diagnosis clinically, but you need to confirm it. Now also I am sharing with you here the images of the autofluorescence in this particular patient, and so you can see the different features, how they look like, where you have these deposits, and the other areas where you have almost like a leopard skin appearance, which is so important to demonstrate. And of course, then look at the angiograms here, and you can see these vessels. Of course, you have leopard skin here, as well as you have these vessels which are over those areas which are sort of leaky. So they are over those areas where you have subretinal deposits. And of course, this is the autofluorescence, over here. And once the plasma vitrectomy with subretinal biopsy was done, you can even demonstrate through the gas, you see, a very good image of the area in the periphery from there where the biopsy was taken. So you see very nicely document everything what has been done, and even you can be sure and even show to the patient sometimes. Of course, I'm not going into detail here. That's not that this was confirmed as a B-cell lymphoma, and ultimately methotrexate first twice weekly, then once weekly, then once a month. Total 25 injections were given per eye. You can see here a lot of injections were given, and you can see here how the whole thing changed after injection. This is the right eye, and the much more was the left eye. You can see what happens from count finger. It became 636, and you can see with methotrexate all those lesions or the deposits, they have disappeared. So I'll go to another case, which is a 45-year-old male with sudden progressive vision loss in both eyes. It was diagnosed to be HIV 15 days back only, and was started on the ART, and the CD4 count was 91 cells. And this initially presented to some private practitioner outside and was referred to our hospital. And you can see here the vision is count finger close to face and hand movements. So almost like patient is not seeing anything, but there is a lot of inflammation. Ciliary congestion is there. There are 3+ cells in the anterior segment, flare, you can in both the eyes, but there were no synecdoche. And the pupils were already iatrogenically dilated from outside. And you can see the way the photogram was seen. This is the right eye. So you can see these lesions all are here going all the way to the periphery. And you can see these subretinal lesions, and you can't make out what it is. And they are bilateral. This is the other eye. Now, these are like tiny different size deposits there which are seen. So what are we dealing here? Is it a endogenous endophthalmitis, even syphilitic, or of course may not be on atypical toxoplasmosis could be. And so looking at all this toxo as well as serum HSV, and but what was important here, this turned out to be syphilitic. You can see TPHA was positive, so was here VDRL, and was started on intravenous ceftriaxone 1.2 milligram twice a day for 14 days after neurology consultation. And so you can see what happens that this patient, now this is the day 5, after the vitrectomy was done for the because of the confusion in the diagnosis. And then you can see this is what the lesion have started disappearing. And then this is day 7. And subsequently, you can see the lesions, he started seeing better, but I'm not showing the whole story. The idea is that you can imagine as well as monitor the therapy, and also demonstrate it to the patient, as well as subsequently, if the new lesions are appearing, you will be able to see them very well here. So we also have published another paper. This is the ultra-widefield fundus autofluorescence in management of CMV retinitis. So in this particular study, ultra-wide field fundus autofluorescence showed better delineation of borders of lesion in 29% and larger area of non-involvement in almost 33%, and picked up in 7 of the 970, the recurrence was picked up. And so were the cottonwood, which were not seen otherwise that well. So this is also published recently, in fact, in 2020 in, again, Ocular Immunology and Inflammation Journal. And I am showing you one picture out of that only. If you look at it here, the right on the top and the red arrow here, this is the fundus photo. And if you do a autofluorescence, you can see this border here. And this border is appearing hyper autofluorescence. So hyper, I have not shown you a lot of images, means that something is going on here if it is seen hyper. Otherwise, you see the area which is hypo. And that's what happens. That very area becomes more hyper and activity appears here. And so clinically, in 2 weeks later only, we could see the active and fluffy lesions, and which required management. So I can go and show you some more cases, but I thought these pick up most of the important features. Of course, I have not shown you so many others which are again, especially about the tubercle uveitis. I couldn't get hold of those images here. So in conclusion, ultra-wide field imaging improves the diagnosis and management of patient with retinal pathology involving the mid and peripheral of retina. So that is what examples I have shown you. And ultra-wide field fluorescein angiography, I've shown you a lot of images, some of them just spectral, very, very impressive images. And ICG angiography, in fact, I told you that earlier that we have got for PGI now, the California, they started doing already ICG. So I don't have those images with me. I showed you some of the autofluorescence images, which appear to provide several benefits for inflammatory disorders. I think I'll just suggest to you to go through this particular issue of the journal. And this is the editorial written by Amit Cunningham Monk. And, he's the man who has done maximum work case here as far as the ultra-wide field or the work on optos is concerned. And Manfred, who is the editor of this particular journal, this is editorial. So you have several articles on as far as the ultra-wide field imaging in uveitis is concerned in this particular issue, which is published in 2019 in Ocular Immunology and Inflammation. So thank you, friends, for giving me this opportunity.